Hello, I am Dr. Bindu. I am a senior consultant in ICU. I look after the surgical and the transplant ICU. Nowadays, what we face in the ICU is our bugs which are resistant to multiple antibiotics. We call them multi-drug resistant bacteria or extended spectrum antibiotic resistant bacteria. The problem is that these bacteria are not sensitive to any of the antibiotics that are available in our market, and the amount of antibiotics we have in the market is very limited. So we call this as antibiotic resistance. So why is there so much resistance in the bacteria? That is because we are indiscriminately using antibiotics. Most of the time we use lot of antibiotics from the pharmacy. When we have a common cold, when we are not well, we tend to use antibiotics. Most of the time our infections are because of viruses. There is no treatment for that. There is no need to use antibiotics. But because of the over-the-counter use of antibiotics, the bacterial resistance has grown, and when the patients are really sick, we find that the antibiotics do not act. So what we have to do is we have to stop using antibiotics indiscriminately. If there is a minor infection, minor cold cough, please do not use antibiotics. Only if your doctor recommends, you are having a prescription, then only antibiotics should be used. Everybody in the community should be aware of that, and they should question themselves before using any antibiotic. If the antibiotic resistance continues like this in the community, then we may have to stop our organ transplantation program, because what I find in our transplant ICU is that all the patients who get infections, they are growing multi-drug resistant bugs. Therefore, please remember, do not use any antibiotic unless the physician gives you one.
I am Dr. Mohan Kopikar, and I am a consultant surgeon at Fortis Hospital, Mulund. And I am a general surgeon with special interest in gastrointestinal surgery. And I have been in the profession for more than 35 years. Surgeons and antibiotics have a long relationship, and with the advent of antibiotics, many complex surgeries are done very safely with very low incidence of infection. But of late, the concern for the surgeon is the emergence of multi-resistant organism, which complicates the situation. And that is why the surgeon has to be very alert. He has to send material for culture and sensitivity as and when he can get the opportunity. And the appropriate antibiotics must be used. When there is a multi-resistant organism, it is better to involve infectious disease specialists so that we have a rational use of antibiotics. With emergence of difficult organisms, the responsibility now is on the surgeon to control the source very effectively, like draining or removing the source of infection proactively has become very important.
Myself, Dr. Sanyal, I am the hematologist and the bone marrow transplant physician of the Fortis Group of Hospitals, Mumbai. So antibiotic resistance is a huge problem in our country. So in our particularly the patients who are actually got blood cancers, and they are treated for the same, and they have very low counts, and they landed up with a very severe infection to our clinic and our OPD and IPDs. So most important thing, as a society we should be more prepared for the same, and there are few things to be practiced at the very community level. Number one, whenever the doctor prescribed any antibiotic in the general practitioner's level 2, the patients should complete their course of antibiotic irrespective of their well-being. हम लोग बहुत टाइम देखते हैं 2-3 दिन एंटीबायोटिक खाया, फिर बोला नहीं अभी ठीक हो गया, मैं एंटीबायोटिक बंद कर दिया. ऐसा होना नहीं चाहिए. फिजिशियन जितना एंटीबायोटिक का ड्यूरेशन बताया है 7 डेज, 10 डेज, 14 डेज, उसका पूरा कंप्लीट करने का कोशिश कीजिए. दैट इज़ नंबर 1. नंबर 2, बहुत सारे मेरा क्लोज फ्रेंड्स को भी मैं देखता हूँ आजकल एंटीबायोटिक का अपने आप ही खा लेते हैं. गले में दर्द होगा, ऑगमेंटिन खा लिया, एजिथ्रोमाइसिन जाके दुकान से लेके खा लिया. वो दुकानदार को बोला कितना, दो दे दो, लाइक दैट. तो ऐसा एकदम चीज़ नहीं करना चाहिए, बिकॉज बहुत टाइम हमारा जो सब होते हैं, हमारा जो गले का दर्द, ये सब डायरिया होते हैं, आर ऑल वायरल, जिस पे एंटीबायोटिक का कोई रोल नहीं है. एंटीबायोटिक कुछ ठीक भी नहीं करते हैं, एंड मोस्ट ऑफ दिस डिजीजेज आर सेल्फ लिमिटेड वायरल डिजीजेज जो अपने आप ही ठीक हो जाता है, बट पेशेंट को लगता है कि वो एंटीबायोटिक के लिए ठीक हुआ है, तो शायद उसका कोई ज़रूरत ही था नहीं, बट वो क्या किया है, आपका बॉडी में एंटीबायोटिक रेजिस्टेंस पैदा करके दिया है, जो आगे जाके जब शरीर में सच्ची एंटीबायोटिक का ज़रूरत पड़ेगा तब मामूली एंटीबायोटिक काम नहीं करेगा। और तीसरा चीज़ है जो मैं मेरा प्रैक्टिस में देखता हूँ बहुत टाइम में, कि हमारा पास बहुत सारे पेशेंट आते हैं वेरी सीवियर ड्रग रेजिस्टेंट बैक्टीरियल इन्फेक्शन लेके, बट इसका जड़ एक दिन में नहीं बनता है, इसका जड़ बहुत पहले से ही शरीर में अंदर घुसता है ड्यू टू इंडिस्क्रिमिनेट एंटीबायोटिक यूज़। तो ये सब छोटा छोटा चीज़ करेंगे तो देन हमारा देश में एंटीबायोटिक रेजिस्टेंस बहुत कम हो जाएगा। और एक चीज़ बहुत ही इंपॉर्टेंट है जो मैं बताना चाहता हूँ, जब एंटीबायोटिक रेजिस्टेंस होता है यू हैव टू टेक मोर heavy antibiotics or higher antibiotics, and that causes more cost problem to the patient, which can be very easily managed, even low cost, lower type of antibiotic if the resistance problem is significantly decreased in our country. Thank you.